we started on a foundation that was profoundly racist, explicitly exclusionary, and that had many forms of harm built into it. And then we continued to perpetuate elements of that, even as we improved elements of that over hundreds of years.
What is it about the healthcare system that needs to be changed in the context of making it more equitable, more just, and more anti-racist?
Yeah, I would do it really in some four simple ways. I think I would like a healthcare system that's people-centered as opposed to profit-centered, that's love-centered as opposed to efficiency-centered, that's community-centered versus corporate-centered, that's public versus private. I think if we can start to do those things, we start to build a different way of being and caring for one another in our healthcare system that allows it to really honor the dignity of humanity, right? And to become a fundamental right and not a privilege for the few.
I feel the system that I envision for myself, if I'm going to make it really personal, as well as some things that I've heard from community members, is a system that actually views me first as a healthy person that they want to keep in that form. And then treatment follows from there, right? As care follows, I want to say treatment, care follows from there. And so if I need something, I get it. And I'm not pumped with something I don't need.
There was never a time when we had whatever systems that were available to support health organized in a way that benefited everyone, that included everyone, and that provided for everyone. That was just never the structure of our healthcare system. So we started with a system that was, first of all, limited, episodic, privatized, localized, and exclusionary. And we built on that. And we put little things here and little things there, and we tried to make it include more people, and we tried to adapt it. But we started on a foundation that was profoundly racist, explicitly exclusionary, and that had many forms of harm built into it. And then we continued to perpetuate elements of that, even as we improved elements of that over hundreds of years. So we're not going to get to this point now and be like, oh, well, just little changes and it'll be okay. I mean, it's sort of like getting the first 10 steps of the Starship Lego wrong, and then thinking somehow at the end you're just going to take off a couple of the last few pieces you put on and that'll make it better. That's not how it works. You have to really go back to the first principles and shift and transform in some fundamental ways.
For more conversations like this, subscribe to our YouTube channel and learn more at meetattheintersection.org.